Dr. Sangeshwaran did his MBBS from Stanley Medical College between 1996 to 2002. He did his diploma in anesthesia in Madurai Medical College 2003 to 5 and completed his MD General Medicine in Madras Medical College from 2010 to 2013. And he has completed a certificate course in diabetes, and he is very well known to all of us, and he is a consultant physician at Manipal Hospital. Over to you, sir.
Thank you for the warm introduction, sir. Good evening to all of you. I once again thank the organizers for giving me this great opportunity to speak in this forum. The topic given to me is seasonal fevers during pregnancy. Before going into the topic proper, I would like to say a few facts about the immune changes which occur in pregnancy. Pregnancy is an immunocompromised state. No, pregnancy is not an immunocompromised state, but it is an immune modulated state, or it can be termed as immune altered state, or it can be termed as paradoxical immune state or immunotolerogenic state. There are a lot of immune system changes which occur in pregnancy to accommodate the developing fetus. There are a lot of immune system changes which occur in pregnancy to accommodate the developing fetus. Meanwhile, due to these immune system changes, the pregnant women are more vulnerable or more susceptible to infectious diseases. And what are all the immune system changes which occur in pregnancy? In short, there is a shift from Th1 dominance to Th2 dominance, that is, from cell-mediated immunity dominance to humoral mediated immunity dominance. Here, the Treg cells, that is T regulatory cells, are getting increased, thereby the increased levels of immunosuppressive cytokines like TGF beta and IL-10. Also, there is reduced activity of NK cells and reduced activity of Th17 cells, which secrete IL-17, a pro-inflammatory cytokine. So here, there is a state which the anti-inflammatory cytokines are getting increased and pro-inflammatory cytokines are getting decreased. So this condition is making the pregnant women more prone for developing infections. And now coming to the common causes of fever in pregnancy. Flu. Flu is the most common cause of fever in pregnancy, followed by urinary tract infections, and followed by respiratory tract infections like common cold and malaria, listeriosis and dengue. Seeing this one by one, flu. Flu is the common cause of fever in pregnancy. It's caused by influenza virus and it presents acutely. There is high-grade fever, presents with acute onset high-grade fever, and it can complicate into severe illness like viral bronchitis and viral pneumonia. And then it can lead to preterm labor, miscarriage, preterm birth and low birth weight. It presents with high-grade fever, cough, sore throat, headache, myalgia and fatigue. It is usually treated with rest, adequate hydration, paracetamol, and if needed, patients can be given oseltamivir, antiviral. And it can be prevented with practicing good hygiene and vaccine, influ vaccine. It needs a special mention here, influenza vaccine. Flu vaccine, it gives protection against 2 A strains and 2 B strains. We are getting protection against H1N1 and H3N2. It can be given to all the adults above 65 years and it can be given to adults less than 65 years who are all with diabetes mellitus, CKD and heart diseases. And children above 6 months of age can be given influenza vaccine. And there are lot of studies establishing the safety of this influenza vaccine during pregnancy and breastfeeding. Coming to the flu vaccine during pregnancy. Flu vaccine is safe during pregnancy. There are lot of studies establishing the safety of this vaccine during pregnancy. It protects both mother and also the fetus. It can be given during any trimester of pregnancy, but the flu vaccine given during the third trimester of pregnancy protects both mother and also to the fetus through the passive transfer of antibodies. So whenever you give the vaccine during the third trimester, it gives protection to mother and also it protects the infant in the first 6 months of life. And next, UTI. UTI is the second most common cause of fever in pregnancy. UTI is common in pregnancy due to the hormonal changes. Here there is increased estrogen and progesterone, so that the relaxation of urinary tract structures occurs. Following, it leads to facilitation of bacterial entry into the urinary tract structures and infection. And there is compression of the gravid uterus and the urinary tract structure occurs, making them more prone for urinary tract infection. Also, pregnant women with gestational diabetes mellitus, also diabetes mellitus patients presenting with pregnant women presenting with diabetes also prone for urinary tract infection. And if there is previous history of UTI, if the patient is presenting with anatomical defect, they are also prone for urinary tract infection. And there are reports denoting that family history of UTI also leads to UTI in pregnancy. And it can cause complications like urethritis, cystitis and pyelonephritis, and it can lead to preterm labor, low birth weight and preeclampsia. And it is prevented with hydration, urination whenever needed, practicing good hygiene, avoiding tight clothings, and it is diagnosed with urine routine examination, urine culture sensitivity and antibiotics if necessary. And another entity, asymptomatic bacteriuria, which needs a mention here, and this is a common condition which affects around 10% of pregnant women. Here there is presence of bacteria in the urine, but there is no symptoms of UTI. Generally this condition doesn't need treatment, but if the colony count is more than 1 lakh CFU per ml, or if the patient is presenting with high blood sugar, gestational diabetes mellitus patients, or if the pregnant women are presenting with any spinal cord injury, they should be treated. And common cold. Common cold is a group of viral infections which usually affects the upper respiratory tract. When comparing with flu, this common cold is less acute, less intense fever, and rhinoviruses are the most common viruses which cause the common cold. It accounts for 30 to 50% of all cold cases, followed by coronaviruses, adenoviruses, respiratory syncytial viruses, parainfluenza viruses, and human metapneumoviruses. Common cold is quite common during pregnancy, and it can cause symptoms like runny nose, stuffy nose, coughing, sneezing, sore throat and headache. It can cause complications like preterm labor, low birth weight and exacerbation of pre-existing respiratory conditions. And malaria. Malaria is very common in tropical and subtropical countries, and nowadays it's becoming very rare in Tamil Nadu, but still a patient presenting with fever and a travel history, fever with chills and rigor, high grade, intermittent, and presenting with gives a history of travel, they should be ruled out malaria first. And the pregnant women are more susceptible to severe malaria. They are getting infected during pregnancy, they are more vulnerable to get severe malaria, and they can develop severe anemia, and if they are getting infected with falciparum, they can develop cerebral malaria, and it may lead to maternal mortality. And as usual, it can develop into low birth weight, preterm birth, and there is risk of fetal mortality is also there. And all the pregnant women should be given the precautionary measures like nets, residual sprays, and if they are going to any malaria prone countries, malaria endemic areas, they should be given sulfadoxine pyrimethamine chemoprophylaxis. And if they are getting infected with severe malaria, they should be treated with injection IV artesunate. And listeriosis, this is uncommon underreported disease. It's caused by Listeria monocytogenes, and this is caused by eating food contaminated with Listeria. It can cause miscarriage, stillbirth, preterm birth, and fetal infection. It's prevented by avoid eating soft cheeses, unpasteurized milk, and eating properly cooked food. Dengue, last but not least, dengue fever is very common in our part of country. Dengue fever can cause severe consequences for both pregnant women and also for their unborn babies. Naturally, dengue can complicate into severe dengue in pediatric population, but in adults, generally severe dengue is rare. But in pregnancy, the severe dengue chances of developing into severe dengue is more. It can cause preterm labor, low birth weight, maternal mortality. What are all the factors contributing to developing severe dengue in pregnancy are? If they are getting infected in first trimester, they can develop severe dengue. And if they are getting infected with the dengue 4 serotype, they can develop severe dengue. So this in general, but in my experience in general, dengue patients, dengue infection in pregnancy leads to moderate symptoms like fever, headache, myalgia, rashes, and it goes uneventful. But chances of developing severe dengue in pregnancy more. They develop severe dengue, they can cause irregularities in blood coagulation, leads to hemorrhage and organ dysfunction, vomiting, diarrhea, dehydration, and electrolyte imbalances. It can cause maternal death, IUGR, developmental anomalies, oligohydramnias. All these complications can arise secondary to dengue. And abortion, the chances of abortion in first trimester is more when they are infected with the dengue. And if they are presenting with the severe dengue and thrombocytopenia, the chances of abortion in first trimester is more. Also, previous history of abortion, first trimester infection, thrombocytopenia, chances of abortion is more. That's all. Thank you.
Any questions?
The range of shares antibiotics in pneumonia and urinary tract infections. Range. What are the antibiotics you prefer
In pregnancy.
in pregnancy?
Usually I will go for cephalosporins along with azithromycin.
Amoxicillin, amoxiclav.
So that also can be preferred, but usually I go with ceftriaxone or cephalosporin sulbactam, or if in some cases augmenting the amoxicillin clavulanic acid along with azithromycin.
Any support measures? Because you are telling immune moderate or you are telling so many things. Any immune support measures to
Usually I
prevent
give vitamin
only
B,
diet?
vitamin B12 supplementation,
Diet only.
diet, hydration.
Hydration.
Some, depending upon the culture report, and in our hospital microbiology department gives sensitivity patterns. According to that we decide.
Can we use all the drugs because the pregnancy?
So, amoxicillin clavulanic acid. I always use amoxicillin acid.
But E. coli is not responsible.
But once we got confirmed, then we can go for another according to the patterns. Yes, sir. Yes, sir.
First treatment is common.
Yes.
What's the reason?
No. Severe dengue in first time is common due to some physiological changes, sir. There is increase in blood volume, and a lot of immune changes also. Blood volume changes can cause anemia. This anemia can cause severe dengue.
Dengue in antenatal, because it pass the antibodies to the fetus.
Yes.
So the infant gets dengue because it is very severe.
Usually the infant presentation, dengue presentation in infant is unlikely to be severe. Infant in first week of life, second week of life, if the infant got infected with dengue, it goes uneven in general.
Mother gets infected antenatally. That the antibodies should be there to cross the barrier gets dengue again, the
Protection will be
secondary
there.
dengue. So severity will be more than dengue.
Antibody dependent enhancement.
Antibody
Antibody already இருக்கிறதுனால the antibody dependent, there is a mechanism called antibody dependent enhancement, sir. That is there in dengue. There is presence, we are getting infected, there will be development of antibody, and they are getting reinfected, reinfection will be severe.
secondary dengue.
Secondary.
So the antiviral drugs safe.
So we are
We are
giving
using the antiviral drugs.
Yes,
Is there
yes.
any side effects as in antibiotics? Should we be
Antiviral.
antivirals?
antiviral. If needed, we can use it, sir. Oseltamivir, we prefer oseltamivir in case of viral pneumonia, viral bronchitis. Then we can, presenting early, we can go for antivirals.
Any precaution measures we have to take, blood test, all those things. Just
Renal-
the antibiotics we are
Renal parameters should be checked before.
normal parameters.
GI infections, which antibiotics is preferred?
IV antibiotics. Reaction, sir. Orally, we can go for.
Quinolones?
No, sir. We don't prefer quinolones. We can go for metrogil and amoxicillin. Amoxicillin, and if needed, IV antibiotic like ceftriaxone.
Metrogil can be.
Yes, we use.
COVID-19 and pregnancy. COVID-19.
I didn't encounter that situation actually.
That was common for the patient because of the coagulation problems.
So definitely
He
it should
had
be
miscarriages and
due to the suppressed immune status. They may present in severe complications.